Hello, Yuba County and Sutter County community. Today, I want to talk about Pfizer booster doses. You know that as of September 23rd, the Centers for Disease Control and Prevention and FDA have recommended Pfizer booster doses for a certain population. It can be confusing, so I'm going to lay it out for you, and then I'll summarize the ultimate recommendation for me. So, for those who have completed the Pfizer primary vaccine series, which is the 2-dose primary vaccine, then since 6 months or longer since their completion, those who are 65 and older should get a booster dose. Those who are living in a long-term care setting, if they're 18 to 64, they should also get a Pfizer booster dose. And then finally, for those 50 to 64, if they have underlying medical conditions such as chronic pulmonary disease, such as asthma, such as type 1 or type 2 diabetes. Then there's a couple of additional categories of people who may consider getting a Pfizer booster dose. And these are individuals who live or work in a high-risk congregate setting. What does that mean? Like if they work or live in a homeless shelter, if they're an inmate at a correctional facility, a jail. Then the second category are those 18 to 49 who also have significant underlying chronic medical conditions. The same one I just told you about previously, type 1 or 2 diabetes, chronic pulmonary diseases, or asthma, etc. But ultimately, the summation is this. If you're 18 or older, you've completed the primary vaccine series for Pfizer, it's been 6 months or longer since the completion of the series, and you feel that you would benefit from the Pfizer booster dose, please go get one through your doctor's office, your local pharmacies in the area, or go to myturn.ca.gov to find the nearest local vaccine clinic. If you got the Moderna or you got the Johnson & Johnson vaccine series, please be patient just for a few more weeks. I know you're hearing about booster doses, but I want to clarify that as of right now, September 30th, 2021, it's only authorized for booster doses for the Pfizer series, not for Moderna or Johnson & Johnson. But both of those companies have submitted data to the Food and Drug Administration, the FDA, and we're hopeful that probably by mid to late October, we will see some movement for booster doses for the those who got Moderna and those who got Johnson & Johnson. Please do not try to mix Pfizer and Moderna or Johnson & Johnson and Pfizer. There's really no data that would indicate its safety or even its effectiveness. As for little kids, 5 to 11 years old, you saw that Pfizer just submitted the data to the FDA this week on Monday. And so we're hopeful, again, the timeline of sometime mid to late October for us to hear hopefully some good news about authorization for the younger children, 5 to 11 years old. And then finally, I want to talk about the fact that if you're still hesitant about getting COVID-19 vaccine because you're concerned that it's going to make your chronic medical conditions worse, whether you have diabetes or you have high blood pressure or you have asthma, you should get it. It actually doesn't make it worse. It helps you from getting sicker because when you have underlying medical condition, your immune system isn't as robust as an otherwise healthy person. So you need the protection of COVID-19 vaccination and being fully vaccinated as soon as possible. Speaking of protection, please get the flu vaccine as soon as possible. I just got mine today, and we need that because we're entering the flu season right now. And we don't want a twindemic. We don't want a surge of COVID-19 cases in the late fall, early winter, in addition to the flu. And you can't really tell the difference between the two. And you can get both at the same time. And you don't want that. And finally, for pregnant women, just yesterday, the Centers for Disease Control and Prevention, CDC, issued a really strong health advisory that pregnant women should get vaccinated for COVID-19 as soon as possible because in the past 2 months, they've seen hundreds of hospitalization and unfortunately even some deaths in pregnant women because they were unvaccinated overwhelmingly and then succumb to their COVID-19 infection. So please get vaccinated as soon as possible. COVID-19 and the flu, please. Thank you.